As we move on in the news here, many African Americans and Latinos are skeptical of the COVID-19 vaccine and the importance of community vaccination.
Vascular surgeon Dr. Lee Kirksey from the Cleveland Clinic joining us live now to explain some of this mistrust that's out there. Dr. Kirksey, good morning. And why do you think the perception is one of mistrust?
Good morning to all of you, and thanks for having me. Well, there's a historic context to this. We have experiments. The Tuskegee experiment represents the most egregious misuse of healthcare research, and that's actually still within the minds of many African Americans and minorities, Latinx community members, that healthcare has sometimes been at the misuse of research, and some people think that this COVID-19 vaccine represents that in a contemporary setting.
In your knowledge, in your background, I'd love for you to maybe explain to what your thoughts would be, what you would want the communities to know in regards to this vaccine.
Well, I think number one, people have to understand that the COVID-19 virus has disproportionately affected African American and Latinx communities. 4 times more likely to be hospitalized, 3 times more likely to die of the virus. And so it's impacted our communities in a much different way than other communities. And this vaccine, amongst the other issues of masking, social distancing, and hand washing, this vaccine represents the opportunity for us to get back to some degree of normalcy, to actually spend some time with our families, to do some of our social activities, to actually get back to work and open up our businesses. And so this is part of a comprehensive plan to actually overcome the virus within our communities.
Can things be done within the community itself, in the African American community, doctor, to maybe help explain this a little bit better? Any community forums or discussions with local legislators or things like that to kind of bring some awareness to it?
Actually, that's very important, because one of the major issues is that there's a lot of misinformation, disinformation out there around COVID-19 and the vaccine. And I think the role that Cleveland Clinic as a major healthcare provider serves within the community is to arm members of the community so that we can kind of cascade accurate information out there. We have faith-based community organizations like the church. We have other organizations that we need to stand up and empower with accurate information to disseminate within the community.
So with that being said, I'm assuming, and I maybe let you expand on it, you'd be encouraging those in the community to seek out these platforms, seek out these areas where if they have questions, if they feel nervous, before they just turn a blind eye to it, they would say, no, here's what you need to really know. Here's what the facts are about this vaccine.
Absolutely. A confused mind frequently says no, right? And so what we want to do is, if you have questions, go to your primary care physician. What I tell people all the time is, I'm not here to persuade people to do things that they don't want to do, but I want to meet them where they live. I want to understand their objections. I ask patients, are you going to get the vaccination? I don't want to be judgmental. I just want to give them information and allow them to make that progression to hopefully ultimately accepting the vaccination.
I was looking at a poll that came out of Pew Research, and they were talking about the percentage of mistrust out there. 63% of Hispanics said they would get it, 61% of white, but only 42% of black Americans. So even with that said, though, there's still a large segment of the population, even with the Hispanic and the white community. 40% of people say that they don't want to get it.
This is not limited to the African American, the Latin community. This is across communities. And we understand that to achieve this idea of herd immunity, we need to have at least 60 to 70% of community members vaccinated, right? And until, as the lead-in said, until all communities are safe, no one community is safe, because the virus will continue to circulate. So we have to understand the objections that exist within each of these communities and address those objections. But this really represents the opportunity. I can't underscore this with greater emphasis, the opportunity for us to begin to move on beyond this pandemic, which has adversely affected all of our communities. We all have someone that's missing from our family, a family member, someone else within our friendship community that's been affected by this virus, maybe severe illness or hospitalization or even death. And this is the opportunity to move forward.
Dr. Kersey, have you had a chance to get the vaccine yet, and how was it for you?
So I actually had the vaccine last week, I guess Thursday. It's about 10 days ago at this point. And it was just like the flu vaccination. That evening I went to play basketball with my kids. The next day I was at work. And so I encourage people to get the vaccine. We've seen people like President Obama and President-elect Kamala Harris, notables, receive the vaccine. Go out there, get the information that you need to protect yourself, protect your family, and protect the members of your community.
Great information.
Yeah.
Dr. Kirksey, we appreciate you joining us. You're joining us again from the Cleveland Clinic Hospitals. Thank you. We hope you have a great day.
Thank you for having me.
Thanks, Doctor.